At some point in the middle of a hospital shift, a nurse walks into a room, reads a number on a monitor, and makes a decision that changes everything for the patient in that bed. No panic, no hesitation, just knowledge applied at exactly the right moment. And the thing most people never think about is that nurse didn't learn to do that in a single class or a single semester. They built that ability piece by piece, layer by layer, over a very specific journey that almost nobody explains from the beginning. That's what this lesson is for. My name is Nurse Nova, and I'm your nurse mentor. Welcome to Lesson 1. Today, we are going to walk through the complete roadmap of what you will learn on your path to becoming a nurse. Every subject, every skill, every phase of training, and the mindset you'll need to carry all of it. This is not a motivational speech. This is a real, structured breakdown of the journey ahead of you, so that nothing catches you off guard and nothing slows you down. Before we go any further, I want to plant something in your mind right now. Something I'll come back to at the very end of this lesson. There is one thing that separates nursing students who make it all the way through from the ones who struggle, and it has almost nothing to do with how smart you are. Most people assume it's about grades or memorization. It isn't. I'll tell you exactly what it is before this lesson is over. But for now, keep that question with you as we go. Here's what we're covering today. We'll start with the foundations: anatomy, physiology, medical terminology, and vital signs. Then we'll move into clinical skills, the hands-on procedures you'll practice, and eventually perform on real patients. After that, we'll walk through how nursing school is actually structured, because most students start without a clear picture of what the phases look like. Then we'll talk about specialties and career paths, because nursing is not one job, it is dozens of them. And we'll close with the mindset section, which is where I'll answer that question I just left open. Let's start with the foundations, because this is where every nurse begins. The very first thing you'll study in nursing is the human body, how it's built, and how it works. This is anatomy and physiology, and it is the backbone of everything else you'll ever learn in healthcare. Anatomy is the structure. Where is the heart? What does the kidney look like? How many lobes does the right lung have? Physiology is the function. How does the heart pump blood? How do the kidneys filter waste? How do the lungs exchange oxygen for carbon dioxide? You learn both together because structure and function are inseparable. You cannot understand why a patient is struggling to breathe without knowing how the respiratory system is supposed to work in the first place. You'll study the cardiovascular system, the respiratory system, the nervous system, the musculoskeletal system, the digestive system, the endocrine system, the renal system, and more. Each one has its own logic, its own language, and its own set of things that can go wrong. And when something does go wrong, your job as a nurse is to recognize it. And that recognition starts here, in these foundational lessons. Right alongside anatomy and physiology, you'll learn medical terminology. Think of this as the professional language of healthcare. Words like tachycardia, which means a fast heart rate; dyspnea, difficulty breathing; edema, swelling caused by fluid. These terms might sound intimidating right now, but they follow patterns. Most medical words are built from Latin and Greek roots, prefixes, and suffixes. Once you learn the building blocks, you can decode almost any term you encounter. Brady means slow. Tachy means fast. Cardio refers to the heart. Pulmo refers to the lungs. So, bradycardia is a slow heart rate, and pulmonary edema is fluid in the lungs. It clicks quickly, and it gives you the ability to communicate clearly with every person on the healthcare team. Then comes vital signs, and this is where things start to feel real. Vital signs are the 5 measurements that tell you, at a glance, how a patient's body is performing. Temperature, pulse, respiration rate, blood pressure, and oxygen saturation. You'll learn the normal ranges for each one, what it means when a number is too high or too low, and how to measure all of them accurately. You'll practice taking manual blood pressure with a cuff and stethoscope. You'll count respirations. You'll read oxygen saturation from a pulse oximeter. These skills sound simple, but they are the first clinical tools you'll have in your hands, and they matter every single time you use them. And woven through all of this is communication. Nursing is a science, but it is also a deeply human profession, and the way you talk to patients matters just as much as what you know. You'll learn therapeutic communication, how to ask open-ended questions, how to listen actively, how to deliver difficult information with clarity and compassion, and how to adjust your approach based on who is in front of you. A frightened child needs a different kind of communication than an elderly patient with hearing loss. A grieving family member needs something different than a post-surgical patient asking about their discharge instructions. You'll learn to read the room and respond appropriately, and that skill will serve you every single day of your career. These fundamentals, anatomy, physiology, terminology, vital signs, and communication, are the foundation that every other lesson builds on. Without them, nothing else makes sense. With them, everything starts to connect. Now here's where it gets more hands-on. Once you have that foundational knowledge, you start developing clinical skills. These are the procedures, the things you will actually do with your hands in a patient care setting. And there are more of them than most people expect when they first start nursing school. You'll learn medication administration, and this is one of the most critical skills in all of nursing. The standard you'll follow is called the rights of medication administration. Right patient, right medication, right dose, right route, right time. Some programs teach 6 rights, or even 8, but those 5 are the core, and they exist because medication errors are one of the most preventable causes of patient harm in healthcare. You'll learn to check and recheck. You'll learn to question orders that don't seem right. You'll learn that advocating for your patient sometimes means pausing before you give a medication and asking why. You'll learn infection control, how to protect your patients and yourself from the spread of disease. Proper hand hygiene, which sounds basic, but is one of the most evidence-based interventions in all of medicine. Personal protective equipment, gloves, gowns, masks, eye protection, and when to use each one. Sterile technique, which is the practice of working in a way that eliminates the risk of introducing bacteria into a wound or a sterile field. You'll learn the difference between clean and sterile, and why that distinction saves lives. You'll learn wound care, how to assess a wound, how to clean and dress it, and how to recognize signs of infection. You'll learn how to give injections, both intramuscular and subcutaneous. You'll learn the basics of intravenous therapy, how IV lines work, how to monitor them, and how to recognize complications. You'll learn how to safely move and reposition patients, which protects both the patient and you from injury. You'll learn how to insert and care for urinary catheters. You'll learn how to perform basic cardiac monitoring and read a rhythm strip. And you'll learn how to document all of it, because in nursing, if it wasn't documented, it wasn't done. Documentation is one of the most important habits you will build in nursing school. Every assessment, every intervention, every conversation that matters, it goes in the chart. Documentation protects your patient by creating a clear record of their care. It protects your license by showing what you did and why. And it protects the entire healthcare team by ensuring continuity, so that the nurse who takes over after your shift knows exactly what happened and what still needs to happen. These clinical skills are not learned once and then set aside. You will practice them in simulation labs, in skills checkoffs, in clinical rotations, and eventually in real patient care settings. The repetition is intentional. Precision under pressure comes from doing something so many times that it becomes second nature. And speaking of clinical rotations, Let's talk about how nursing school is actually structured, because this is where a lot of students feel lost before they even begin. The most common types of nursing degrees include the licensed practical nurse credential, the associate degree in nursing, and the Bachelor of Science in Nursing. Each one has a different length, a different depth of training, and a different set of doors it opens for you afterward. Obtaining an LPN license typically takes less than 1 year if attending school full-time. An associate degree in nursing typically lasts 18 months to 2 years and is offered by community colleges, state colleges, and technical schools, focusing on core nursing principles and hands-on clinical experiences. A Bachelor of Science in Nursing is a 4-year program that goes deeper into leadership, research, and community health, alongside all the clinical training. Regardless of which path you're